The smoke is traveling across Southern California. So here's what you need to know to protect yourself. The best thing, stay indoors to minimize exposure. That's the biggest thing you can do. Also, your pets, keep them inside because unhealthy air, it's toxic to them. You can also check your air filters. Dirty ones, they make matters worse, and high efficiency ones, they make everything better. Also, don't burn candles or incense indoors, even when the power's out. You could use a flashlight or headlamp. And finally, discard spoiled food, even if it was in the freezer, because when the power goes out, thawing spoils everything and refreezing will not help you.
Yeah, there are so many of us that still are without power. And
You're without power right
now.
A
couple of days now without
Yeah.
power, and it's tough. And those helpful tips, we've got to throw everything out.
Right, and it's things that you don't think about.
Exactly, exactly. All right, we are now joined live by Dr. Cedric or Jamie Rutland. He's a smoke expert and national volunteer medical spokesperson with the American Lung Association. Thank you so much for joining us. First, now, what groups are most impacted or susceptible for having problems right now?
Yeah, there's a couple of ways to think about this. The first way to think about this is individuals who are healthy without medical problems. The individuals that are at most risk are any newborn child up to the age of 5 years of age. You also have people who are over the age of 60 and pregnant females. These are the individuals who are normally healthy, let's say. These are the individuals who are most at risk. And then obviously individuals with chronic medical problems like chronic lung diseases like asthma, COPD, individuals with cardiovascular disease, coronary artery disease. We know that wildfire smoke can induce significant atherosclerosis and cardiovascular disease. You'll see an uptick in myocardial infarctions in those areas as well. So this is a population of patients to be worried about, and neurologic conditions. We know that carbon monoxide poisoning contributes to neurologic disease, and that's one of the things you're going to see in this area of the country right now as well.
Yeah, good to know. We're urging people to stay indoors, but, viewers, some of them have to be outside. So what precautions can they take? And are there precautions that we can also take inside?
Yeah, the precautions that you can take when you're outside, here are the things that are the most important. Again, every breath you take, you're inhaling that environment. And so you want to reduce the burden of particles that you're inhaling. So if you're going to be outside for a significant amount of time, you do want to wear a mask. Now, there's a surgical mask. There are N95 masks. If you wear a surgical mask, you're going to reduce that burden by 20%. If you wear an N95 mask, you're going to reduce that burden by about 80% in terms of the particles. You also want to cover your skin and also protect your eyes, because there are all kinds of molecules that are floating around in the air, different liquids, different solids, different gases that have a significant impact on your health, increasing that inflammatory response.
So even those N95 masks that we have from the pandemic, those are still better than nothing?
Those are better than nothing. 100% the N95 mask that you have in your cabinet from the pandemic, or the surgical mask that you have in your cabinet from the pandemic, definitely. Again, for me, I've got a 12-year-old, I've got a 9-year-old. My 12-year-old has asthma. So if she has to go outside for a particular point of time, I make sure that she has a mask that she's wearing, because I know that the same molecules that are involved in her asthma are going to be upregulated because of that smoke that's outside.
Well, the smoke has been in the air for days and will continue to be in the air. So what are some long-term impacts that people might be dealing with?
Yeah, it's such a great question. When you look at the wildfire is not just burning wood and burning dirt. When you look at burning of dirt, you're going to increase the amount of fungal spores that are in the air. So people can develop fungal disease, inflammation, infection. You can develop bacterial lung disease as well, because there's more bacteria latching on to these particulate matter particles that are floating around in the air. So you're going to see some pneumonias. I've got a couple of cases. I remember from the last wildfire escapade, a lot of patients presented with fungal disease. Long-term wise, when you burn houses, you're burning plastic. Plastic and the chemicals that are created secondary to that burn contribute to diabetes and other endocrine organ problems, which is really, really interesting. So you may see more diabetics in the future because of that. You're definitely going to see a lot of asthmatics because you're increasing the inflammatory process in that airway as well.
Dr. Rutland, thank you so much for being with us. Everyone needs to remember, take those masks with you, keep all of those masks handy, and don't go out without them.